Welcome back to the deep dive. We're pushing on with our headache series today, and we're focusing on something really critical, especially for you preparing for PLAB or UKMLA exams. Carbon monoxide poisoning, CO poisoning. Our goal here is to pull out the key things you need to spot this silent danger and, crucially, how to manage it.
Yeah, it's a tricky one because CO poisoning, well, it often just looks like everyday stuff, really deceptive. So you might have a patient, they've had this headache for maybe a month, and they describe it as, all over or maybe like a bursting feeling. But the initial checks for migraine or sinusitis, tension headache,
The usual suspects.
exactly, they often come back negative, and that's where you need to start thinking a bit wider.
Okay, so if those common causes aren't fitting, what are the big red flags? What really points towards CO?
There are two really key things. First, the headache gets much better when they leave the building, when they go outside. We call it outdoor relief.
Outdoor relief, right?
Mm.
Makes sense.
And second, finding out if other people in the house family, flatmates, are also feeling unwell. Maybe similar headaches or just feeling tired, nauseous, that kind of thing. Non-specific, but a pattern.
That pattern is so important. And when you're asking about their environment, is there a good way to structure those questions?
Yeah, absolutely. The command mnemonic is brilliant for this, really helps cover the bases.
Okay, break that down for us.
Sure. C is for cohabitants who lives there. Are they ill too? Any kids or pregnant women involved? That's crucial.
Got it. C, cohabitants.
O is for that outdoor relief we just mentioned. Does it get better outside? M is maintenance, any recent work on gas boilers, cookers, even indoor BBQs, bizarrely.
Okay. Maintenance?
A is for alarm. Do they actually have a carbon monoxide alarm, not just a smoke alarm? They're different.
Good point. A for alarm.
And H is housing and ventilation. How's the airflow in their home? Is it poorly ventilated?
Okay, coming to H. That's really useful. Now, something you mentioned earlier, the examination findings can be deceptive.
Hugely deceptive. You might examine the patient and they seem fine. Alert, oriented, no neurosigns, no fever. They don't look acutely unwell.
Which could easily put you off the scent.
Exactly. And here's the absolute killer point, especially for exams. Normal oxygen sats on a pulse oximeter. They mean nothing here.
Right. Why is that again?
Because the pulse oximeter, it just can't tell the difference between hemoglobin carrying oxygen and hemoglobin carrying carbon monoxide.
Yeah.
So a normal SpO2 reading is falsely reassuring. Don't fall for it.
Vital point. So you've got the history, the pattern, you've avoided the SpO2 trap, you suspect CO. How do you tell the patient?
You need to be clear but calm. Use the tell, ask, explain, check approach. So tell them straight. I'm concerned this might be carbon monoxide poisoning. Then ask, what do you already know about carbon monoxide? Gauge their understanding.
Okay.
Then explain. It's this invisible, odorless gas, usually from faulty appliances. Explain it their symptoms, the pattern, the outdoor relief, it all fits. And crucially, explain it's a medical emergency.
Emphasize the urgency.
Absolutely. And finally, check. Just confirm they've understood what you've told them.
Right. Tell, ask, explain, check, good framework. And then the immediate actions. What's the management plan?
Okay, it's a 6-step emergency plan. First, immediate A&E referral. They need to go to hospital right now. Offer help getting there if needed.
Straight to A&E. Step 1.
Step 2 is in the hospital. Confirmatory testing. That's a carboxyhemoglobin blood test, the COHB level. That measures the CO.
COHB. Got it.
Step 3, treatment. If those COHB levels are high, it's 100% oxygen through a non-rebreather mask. That helps flush the CO out. And you need to consider hyperbaric oxygen HBO, especially if levels are really high, say over 25% in an adult, or actually any significant level if the patient is pregnant because the fetus is so vulnerable. Also consider HBO if there are neurological symptoms, loss of consciousness, or severe acidosis.
Okay, so high flow oxygen, potentially hyperbaric. What about beyond the patient themselves?
Right, crucial wider steps.
Yeah.
Step 4, notify public health. CO poisoning is notifiable. They need to know. Step 5, inform the landlord, if relevant. They have a legal duty to get a gas-safe engineer in to find and fix the source. It's the law.
Essential. And step 6.
Step 6, test the household. Everyone else living in that property needs checking at the hospital too, even if they feel fine. CO can affect people differently.
A whole household approach. Makes sense. And what about safety netting before they leave A&E or for follow-up?
Super important. They absolutely must not go back to the property until it's been checked by a gas-safe engineer and declared safe. Cannot stress that enough.
Don't go home.
No. And advise them. If symptoms get worse, confusion, dizziness, chest pain, come straight back to A&E or call an ambulance. Give them info leaflets, arrange follow-up, maybe in a month, and talk prevention. Get appliances serviced regularly, install CO alarms, keep areas ventilated.
It really is striking, isn't it? How something as common as a headache can signal this incredibly dangerous hidden threat. This whole scenario underlines how vital it is to think beyond just the patient in front of you, to the environment, the whole picture. Real holistic care.
Absolutely. It's a classic test of good history taking, clinical suspicion, and frankly, acting decisively on public health grounds, too. So, a final thought for you listening. Thinking about those subtle signs, the outdoor relief, the others getting sick, how could we better raise public awareness about those clues, not just waiting for an alarm to go off? How many cases could that prevent?
Thanks for tuning in to PLAB Talks. We'd love to hear your feedback, and we'll be continuing the headache series in the next episode. Stay curious, and see you soon.